It's a pill, I have it here, that you swallow. It's got 2 cameras in and a light, and it takes 50,000 images as it traverses from your mouth to the toilet. Patients need to take bowel preparation like they would for colonoscopy, so patients need to be fit to take bowel prep. The images are transmitted wirelessly from the capsule to a data recorder which the patient wears on their waist. And the data recorder is then returned wherever the test was done. The data recorder is docked, the images go up to the cloud, and they're read by a specialist nurse and a consultant gastroenterologist. And the report comes back normally about 3 to 5 days later after the test. Even before the pandemic, there was a mismatch between demand, those patients needing lower GI investigations, and our capacity, our ability to do lower GI diagnostics. So we looked for new technology to fill that gap. We did a small technical feasibility study in the Highlands and then rolled that out to a much wider evaluation. In fact, it was one of the biggest evaluations of colon capsule endoscopy in the world. The pandemic intervened and the team quickly got together and started to roll out the service across health boards because traditional colonoscopy had been curtailed. So who is colon capsule endoscopy for? Well, it's for patients with new symptoms that have gone along to primary care to see their nurse practitioner or general practitioner and have been referred up to hospital for investigation. We'd like those patients to have done a FIT test, a poo test looking for blood in their bowel motion, so that we can appropriately target the test to the right group of patients. The colon capsule is best used for those patients who are at low risk of developing bowel cancer, so those that have a lower FIT range, or who have red flag symptoms but their FIT test is negative. Colon capsule endoscopy doesn't replace colonoscopy, but works in tandem with it. It's a diagnostic tool and is highly accurate when the test is complete. If the capsule finds something, however, the patient is then referred up for a colonoscopy or a shorter camera test called a flexible sigmoidoscopy, because these modalities have the ability to biopsy and to remove things that the colon capsule can find. There are lots of advantages of colon capsule endoscopy compared to colonoscopy. Firstly, it's painless. Patients don't feel the capsule as it tumbles through the gut. And secondly, the complication rate is really rare and certainly much less than colonoscopy. The other major advantage is that the capsule test can be done anywhere. So it could be done in hospital, it could be done at a community hospital, it could be done in a local general practice, and eventually it could be done in a patient's home. Data has been at the centre of what we've been doing in ScotCap. We have a national registry, so every patient who swallows a capsule, their outcome data is recorded centrally. Every patient who attends a capsule clinic is asked to fill out a patient experience questionnaire, and we have 1,000 of those. And 97% of patients who attend our clinics across Scotland think the service is either very good or good, which is quite remarkable. There's no such thing as a perfect test, however, and for some patients where the capsule test has been incomplete, either because the capsule's not seen the whole of the lining of the bowel or the bowel preparation hasn't been good enough, those patients then need to go and have a further test. Also, if we find something on the colon capsule endoscopy, such as a polyp, those patients will then be offered a further test, such as a colonoscopy, to have that polyp removed and sent off to the laboratory. Those patients would then have to have 2 bowel preparations. But as long as we carefully explain that to patients before we start the test, then that's acceptable for the vast majority of patients who will choose colon capsule endoscopy over a more traditional test. Innovation is in our DNA, and we're going to continue to iterate and innovate our service. We're going to move the capsule closer to the patient. We're going to trial GP delivery. Indeed, we're going to trial home delivery in the Western Isles so that patients in their own home can have the test. There's some game-changing technology which we'll embrace and test within the program. And artificial intelligence is coming, so we're going to use AI to read and report those images that the capsule generates. We have to iterate, we have to innovate for the benefit of our patients, and I truly believe that if we embrace this across Scotland, it will change the face of colorectal cancer in our nation.